And there's no question that being a trauma and emergency physician is a different career path. You have to be somebody who not only is an adrenaline junkie, but you have to be someone who's comfortable making decisions with well less than the amount of information you'd like to have. Most physicians, have a full patient history before they take a patient to the operating room or do something surgical. You have the luxury, most surgeons have the luxury of having the patient not having eaten since, midnight the night before. The patient's medical history, what medications they're on, what their medical allergies are, everything. For me, 50% of my patients came in, with a hamburger hanging out of their mouth at the time that they had their accident or their whatever happened to them. So, and you frequently don't even have a patient who's awake and alert and able to answer questions. So it is a different type. That said, there was so much my training, and I think I got stellar training. I trained in emergency medicine at a huge level one trauma center in North Carolina. And it was a lot like the military. There's a certain body of information that our attendings, that our professors knew we needed to learn in a finite period of time, the number of years you would be there. And therefore, it was required that you worked fundamentally 7 days a week. I remember we got generally 1 day a month off. We're lucky unless it was busy and unless one of your colleagues, fellow residents, was on vacation or maternity leave or something, in which case you might go 2 or 3 months without having a single day not in the hospital. But what that allowed you to do was see a tremendous number of patients. And that is in contradistinction with what they're doing today. They are coddling these medical residents. They have limits on the number of hours they can work. They have, X number of days they have to have off a week or a month. And the problem is that at the same time that they've cut back, where say you and I may have worked 80 plus hours a week easily, perhaps, up to 100 hours a week, they've now cut that back to, 40 or 45 or 50 hours a week without extending the length of the residency. So they are seeing, on average, probably 50% of the patients that you and I saw. So there's only one way to get really good at treating a gunshot wound to the chest or an appendicitis or whatever it is, and that's to do a lot of them. And you do it in the controlled setting of the residency. If you have limited the hours by 50%, then frankly, in reality, the length of the residency should increase by twice. Rather than 4 or 5 years, it should be 8 to 10 years, because that's how long it would take you to see that same number of patients. And this doesn't even get into what you suggested about DEI. The idea that there are people in these residency programs that couldn't, of their own volition, actually make it through medical school. I didn't get a tutor. I didn't get somebody to allow me. I didn't get to retake the exam if I failed it. I didn't get that. Now those are opportunities that are given to these people till they get through. So I do worry that the caliber of people coming out of medical school and the caliber of the physicians who are now going into practice on their own out of residency is nowhere near what it was back when you and I were doing it.